Could you tell me about using an implant and a patient's own skin and muscle?
Typically, that would involve taking skin and muscle from the back, and this is called a latissimus dorsi flap. And this flap is brought around to the front of the chest, and the muscle is used to cover the implant, and the skin covering the muscle is used to replace the skin that was removed at the time of the mastectomy. The latissimus dorsi muscle comes from the back. So what we need to imagine is looking at the back of the patient. And this represents the arm, and the shoulder and the neck, and then the other side. And this represents the midline of the patient here at the back. And the muscle runs all the way from the lower part of the back up towards the axilla. And when we do this operation, we take a paddle of skin and the underlying muscle, and we rotate the muscle and the skin all the way underneath the arm to bring it around the front to do the breast reconstruction. The result is that the patient will have a scar in the back along the bra strap line. So when we bring the latissimus dorsi muscle flap around to the front to reconstruct the breast, we need to imagine it will look something like this. The mastectomy scar may look something like this. And we open the mastectomy scar, and then we replace the skin of the breast that was removed during the mastectomy with the skin of the latissimus dorsi muscle. And typically this may be placed something like this. This skin is attached to the underlying muscle, and the muscle is then placed underneath the mastectomy skin envelope and is used to cover the implant. And our implant will sit underneath the muscle. Sometimes we put in adjustable implants, and these implants will typically have a little port or a valve that is placed underneath the skin, and this allows us to adjust the volume of the implant after surgery, thereby adjusting the volume of the reconstruction to try and match to the opposite side.